Assalamu alaikum. In the communication day, we have Mr. John Teddy, 55 years, following with the neurology clinic for behavioral change, along with difficult swallowing and depression. Okay, investigation revealed diagnosis of Huntington disease. Please sit with Donald, 30 years, the son, and address his all concerns. Are you ready, Dr. Sarah?
Yes.
Okay, here you go.
Hello. My name is Dr. Mahmoud. I'm one of the
Hello?
Yes, my name is Dr. Mahmoud. I'm one of the doctor here in the clinic. Am I talking to Mr. Donald?
Yes, I am.
And are you the next of kin of Mr. John Teddy, 55 years old? Is that correct?
Yes, I am.
Okay, so I'm here today to discuss about your father's condition and address all your concern. Is that okay with you?
Yes, sure, doctor.
Yes, but first, can you tell me how much do you know about your father's condition in order to be on the same page and address all your concern?
Yes, my father was misbehaving for the last 1 year. I thought something related to stroke. We did a lot of scans, but they told me nothing there. And recently, he's unable to eat well. Sometimes he had choking, and I don't know what's ongoing with my father, doctor. It's something serious with. And also, I notice his mood is always low. He's sleeping all the day and the night. He's not okay, doctor.
I really appreciate all your concern. Did anyone explain for you the diagnosis of your father?
No, no. According to the nerve doctor, they admit him this time, and they told me it might be the possible diagnosis will reach by what's called genetic testing, and I'm here for that.
Okay, so I have the result of genetic testing with you. So I will explain it for you and address all your concern. So, as you're saying that your father has recently started to have this shocking and also disturbing problems with his mood and sleeping all the time. So we did the genetic test, which shows that your father has a condition called Huntington Korea disease. Have you heard about this condition before?
Never, doctor. Is it cancer?
Yes, I really appreciate your concern, but let me explain it for you. Huntington Korea disease is not a cancer. Is a disease that can run in family, and this disease is make brain and affect his movement, his thoughts, and his feeling. This is what's happening with your father, and this is a condition is mostly run in family.
Oh my God, doctor. You mean it's something serious, doctor?
Unfortunately, this condition is not a curable condition, but we try as much as we can to manage his symptoms, and I'll help him to live with his daily activity and to decrease the decrease any symptoms that he's having.
Okay, doctor. So what you will do with him, doctor?
So your father is admitted with us. So we have included a group of doctors, including the nerve doctors, and also we included the physiotherapist and occupational therapist. All of this thing with all these people will help him with the symptoms. He told me that your father is choking. So we have also a specialized team in speech and language therapy team. We call it SOUL team. This team also is reviewing him to assess his swallowing to be safe, and we'll see what we can help him to make the swallow safe, because we don't want him to be choked, and this choking also can cause the food to go from the food pipe to the windpipe and can cause for him chest infection. So we try to prevent all of this by being reviewing by all our team doctors. And also the physiotherapist will help him to improve his muscle strength. And we'll try to help him to keep him more dependent and to decrease all these symptoms that he having and to control it. How does that sound?
Yeah, doctor, all what you said are great, but I feel, doctor, my father, you said it's not curable, right? So he will not be back, doctor, to his normal life.
I'm really sorry, and I can see where you're coming from. But unfortunately, as I told you, this condition, as I mentioned, I discussed with you that his condition is not curable. So there is no definitive treatment for it, but we will give some medication to control if he have, sometimes some patient may have some involuntary movement. So we'll try to decrease this by some medication. And,
Okay, doctor. I appreciate all your work, doctor, and your care for my father. Okay, I can't say anything, doctor. Thank you.
and we'll exclude also the mental health doctors that can help him with his mood. And
Oh,
they might give him some medication to help him with his mood also. And you're saying that he has low mood, so we'll help him with all of that.
okay, doctor.
Yes. And do you have any other question for me or anything I can, because I see that I give you a lot of information and a lot of things today to digest. So if you want to ask me any question, you can ask me.
No, doctor. It's
Okay.
clear for me now.
Yes, and as I told you, this condition also is run in family, so it's I want to tell you that some of the family member can have this condition.
What you mean, doctor? Am I in a risk for that?
You might be at risk of that because this condition can affect about 50% of the
Oh
generation.
my God. What
Mhm.
to do, doctor? What should I do?
Um, I will explain for you because, as I told you, this condition is not curable. But if you want to do a genetic testing to see if you have this no no, we can you can do it. But let me explain for you the pro and cons of having this testing.
Mm-hmm.
Okay, so this testing, as I told you, this condition is not a curable condition. So many people when do this testing, and it's become positive, it makes them more anxious and more depressed, and to have this manifestation is unpredictable. So many we don't know exactly any person might have the gene when he might have the manifestation with him. So this is the cons of having this testing. But the thing that we can do the genetic testing if you are planning to have a baby. So I just want to ask you, do you have children?
Not yet, doctor. I'm planning for the, yeah, for marriage.
So you might this can be helpful in genetic counseling after marriage. So they started to check for the gene and can select they can try to help not having this condition inherited in the offspring and your kids.
Okay. Thank you, doctor, for your care. That's appreciated, doctor.
Yes, and also it might also
2 minutes left.
okay, and some people may, after doing the genetic testing, it's this and have been tested positive. This can affect their insurance. So this is your decision at the end if you want to do the testing or not. Because by doing the testing, as I told you, this condition is not curable. All the treatment is only to improve the symptoms. So you can have a think, and I can arrange for you a follow up in the genetic testing clinic. So they are in best position to explain for you everything, and you can have some time to discuss this with your family. Um, and can I ask you, do you have any other brother or sisters?
Yeah, doctor. I have two brother and one sister.
And any of them has any of this condition? Not.
So far, no, doctor.
Okay, so you can discuss it with them, and they can also uh, go to see, to check if they want to do this genetic testing or not.
Okay, doctor, I will think about that.
Okay. And regarding your father,
Uh-huh.
I want to reassure you that we will try to help him with his symptoms, and on his discharge, we will try to give him a package of care, and the occupational health therapist will visit him at home to make the home safe for him, and
Mhm.
they will do they will try to put give him a lot of things that help him facilitate eating for him and facilitate everything. And also the soul team will review him to check his swallowing and the mental health doctor and
Oh,
all of this. And I just want to ask you, is your father have any put anyone to on his behalf to take any medical decision?
yeah, doctor, I am the one.
Yeah.
Perfect.
Okay. And does he have expressed any wishes of the medical care for him?
No, doctor, no, I don't remember.
Okay. Okay.
Time's up.
Okay.
Really perfect. You touch the last thing, which is important also at the end, but you did it.
Okay.
Really, yeah, I don't have comment apart from, as I told you, yes, you tried to avoid it. You mentioned one time, as we mentioned, or as we discussed.
Yeah.
And the second thing, the anticipation. You can give him a hint about the anticipation because sometimes the disease comes earlier in
And
the
offspring.
next, yeah, in the next generation.
Mm.
However, you give me the cons and pros for the genetic testing, and the only situation you prefer to do it whenever you are planning for babies or having babies or for marriage. This is the only good thing. Apart from this, the testing will be harmful for him. He will be anxious because of the result. He will also affect, or his insurance will be affected. Maybe the test will be negative, and this is also will be a good point, but also sometimes maybe negative, false negative. So he might have the disease, although the test is negative. Anyway, don't encourage and don't discourage. Be in neutral and just give him, yeah,
Yeah.
for the welfare, whenever planning for fertility or conception, please review the genetic counseling team for selecting the sperm or selecting the gene or the code to be safe in your babies or in the future.
Mm.
The advanced directive, as you said, also should be discussed as his father is progressively worsening. He might be comatose, or he might be confused, or he might be more deteriorated his awareness or his cognitive function, and you should ask about these things. Lasting power of attorney, he will be nominated and it will be documented in the file, along also with expression of any wish. Also, it might be documented in the file that he doesn't have or doesn't want anyone to do CPR or chest compression or whatever his wish. He want to die at home. He want to be not admitted. He doesn't want to be intubated. Whatever his wish, you should ask, because maybe the next time or the next meeting, his father will be in coma or in critical condition that he necessitate to be intubated. But if he has wish for that, you will not do anything.
Yeah.
Yeah, for me, I guess you did everything in this scenario. Well done. And
Thank you.
if you have question, you can ask.
No, I was just asking about the pregnancy, but in male. But you said that we select the sperms which can doesn't carry the
Yeah,
code.
yeah, yeah.
Yes. Okay.
It's equal. Either selection of the ova in the female, selection of the sperm in the male.
Yes. Okay.
Both are
I
available. Yeah.
did discuss with me about the genetic testing, so I should open it with him if he didn't say.
Yes, yes, exactly.
Okay.
Perfect. Exactly as you did. You
Mm.
have to tell him that you might have these symptoms in the form of some abnormal movement, some low mood. If anytime, either you or your brothers, anytime you have these symptoms or manifestation, don't hesitate to call us or to seek medical advice. You have to give him some safety netting about the disease. He doesn't know the detail. And the good thing when you ask about the brother and sister, yeah, but what to do? To do genetic testing only, or even to give them some instruction about the disease. They
Yes.
might manifest with tremors or abnormal movements, behavior change. Please, whenever you have these, please visit us. Why? Because this is the explanation. This disease runs in family in 50% in each child or in each kid. And in the second or the next generation, the disease might appear earlier than the previous generation, which is your father. So you have two reasons to give them some instruction about disease. Don't encourage, but the only good thing to do whenever he's planning for having a baby, he can do the testing to have a safe baby. This is the only cons for this test. Apart from this, it's not encouraged or it's discouraged thing to do. Don't or discourage the testing or the other things. Anxious or anxiety, patient will be stressed all over his life. The insurance affection, it might be more affected in the future, the next year, if the test is positive, for example. And no benefit as well from that diagnosis. He will not take any medication, just he will know that he has the disease without any benefit. Okay. But the only benefit he can get, as I said to you, it's selection of the sperm if he is planning for conception. Apart from this, you did great, Dr. Sarah.
Thank
Well
you.
done. Yeah, well done. You have any question other than
No,
what you
no,
said?
thank you so
Any
much.
question from others? Any comment? Counseling about the disease as also breaking bad news good way also to explain it. And the result with me, it's as not as we hope. What you mean, doctor? It's a condition called blah blah blah. As Dr. Sarah said, the same way. Sorry to be the one sharing this news with me, with you, and your father condition might deteriorated more and more. He might not be awake with the future. He might also not able to get oral intake or swallow well because of the friction of his swallowing and so on. You can explain in this way and also the abnormal movements and the depression. Okay. This is the way how to counsel about the Huntington. And the genetic testing, you have to raise it by yourself. Either he will ask or you will raise it by yourself. Any question from others, please?
السلام عليكم دكتور باسم.
وعليكم السلام ورحمة الله وبركاته.
دكتور جزاكم الله خير صراحة، عمل ممتاز وفوق الممتاز. الله يجزاكم خير وفي ميزان حسناتكم.
آمين يا رب
دكتور
أجمعين.
my
Yes.
my question, is it important to ask is he next of his kin or not? Because
Yeah.
I heard
Yeah.
Dr. Hazid before said don't ask this question because if he said he's not next of his kin and you proceed, you will fail, and if you stop also you will fail.
No, no, no. This is not happening. If you can say two
Why?
things.
Yeah.
You can see, are you the next of kin of this person? So he will say, because they are not doing this. They have a specific scenario. It's not no, I'm not, or these things. Or you can say, I believe if the father is conscious, I believe you that your father is aware about our meeting. But I think this is not happening because they have specific scenarios. They should stick on it. They're not saying that if this scenario contain confidentiality, you will have it in the scenario, frankly. But I don't know. This is, you say, are you next of kin and finish? Because the scenario already is written that you are talking to him about the
Yes.
condition. So there is no, people are saying
Yes.
this is wrong.
Yeah.
The
I
exam
will
is
ask.
like this.
Yeah, I will ask you, Dr. Ahmed. Did you see
Yeah.
the feedback of someone written for him? He asked about next of kin in the negative feedback as
No,
or
no,
as
no,
me.
no, 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 no.
So
Only
don't
only Dr.
believe.
Salah, only in one session.
Okay,
No,
okay.
some
Let's
people
guess.
are doing these things to make them, but this is not happening in real exam.
Okay,
Some
let's
people are doing
guess.
this session.
Yeah, sorry, Dr. Sarah. I will be with him. Okay, for a while.
Okay.
Let's say you started with this question, are you the next of kin? And he said, no, I am not the next of kin. What you will do? You will withdraw from the station? No, you will ask him, so you are the son? Yes, I am the son. Proceed. It's not some not I mean, it's not fatal to ask this question. And if he said, no, I am not the one, you will withdraw from the station. You will continue also. Okay, you are not of the next,
Okay.
okay, but you are the son? Yes, I am the son. Okay. We are here to discuss your father condition or whatever. But I don't think he will fail you because you ask for the. In the opposite side, he might give you good mark because you ask this question. Why? Because you are
Yeah.
taking care to whom you are talking, not everyone or not anyone. You will talk with him about this man condition. He should be the
Yes,
son.
yes. You are right.
Yeah. In
You
addition,
are
not
right.
only the
Thank you,
son.
doctor.
Yeah, most welcome, doctor. But we should believe about the real things in the exam. How they will fail
Okay.
for this question. And if they fail, okay, let's see one of our colleagues had a comment. He asked about the next of kin. I didn't see, never ever in the basis practice. And also you can
Okay.
ask
Thank you.
everyone, no problem, doctor. It's okay. Most welcome. But
Doctor,
you can, yes.
I listen one fair by this issue. Ask the patient, ask the next of kin, I think, son. Are your father aware of this meeting and give you permission or يعني consent to talk to you about his condition? He said no.
Okay,
After
this is
that,
different. The-
candidate tell him, okay, if not give you permission, I can't to discuss with you any issue about your father.
So,
After that, patient wait
mm,
and candidate wait and examiner wait. After 10 minutes finish, give him 0 in the
yeah,
station.
of course, zero. He didn't do anything.
He want to take permission. If not take permission, I can't to
Why
pay.
you are waiting for permission? You are for the exam. You are going to the exam to take permission from the father to talk about his condition or to practice the scenario.
Allah, I think
Think logically how you will go there without practice. So don't assume
talk
that you are very
without
smart and
permission.
clever than the examiner, that you didn't get the permission and you will not practice because I don't have the permission, and he will clap for you. Yeah, perfect, perfect. You didn't practice because you don't have permission. No, it's not
No,
this
it's
by
not
this way. You
talk
have to be
about
smart.
permission. This mean breaking confidentiality. This negative sign for him.
Um,
If talk examiner baby give
Okay,
him, you get my
okay.
point.
I got it. I got it. But it will not be believable to waiting for permission, or not to assume that you have permission and to proceed. The way to do it, to say, I assume we have permission from your father to talk about his condition. By this way, you kept the confidentiality and you practice the scenario. But to stuck between and saying, no, 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 sorry, I can't talk with you because you don't have permission from your father. Excuse me, I will leave this station, or I will just sit here for 8 minutes looking at each other without talking. Why you went to the exam? Don't be, or don't act like you are very clever, that I will get the mark because I I didn't touch the confidentiality. I was taking care of the confidentiality. Uh, oh my God. He deserve, of course, the zero, not only zero, big zero. Okay. So please,
والله
do,
he can do like this doctor, which you feel.
no, no, no. He can't.
I-
He can't minus you by this way. If you said, I assume that we have permission from your father, this way you will get the full mark. In the opposite side, if you said, oh my God, you don't have permission, sorry, I can't talk with you, so of course he will fail you, zero, of course, zero. But you have to practice. You went there to practice. So don't act like you are very smart or you are clever than the examiner. That you want to show him that you don't have permission. Okay, who asked you to take the permission? You can assume there is permission already. Okay, this is the way. Okay.
Okay. Assume or he said for him, I
Yes, I
believe.
assume. No, 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 no. Assume there is permission from your father to talk about his condition.
Okay.
And if his father comatose or he lost his consciousness go ahead. Don't ask or don't assume or don't do anything else. Just practice because he's comatose. So what you will do? Do you need the permission from comatose person? No, he's already comatose. So you can talk safely about his condition. He's already comatose or he is already going to die. What the benefit of asking the permission or assuming the permission? The only permission when the father is awake and he's sitting, for example, at the end of the bed and you are sitting with his son and easily will talk about him. No, you have to get the permission or you have to assume there is permission because this is exam purpose. You will not ask, please, uncle, can I get the permission? No, you can assume that there is permission to talk about your father, which who is sitting there. Okay, this is the way how to do it. Okay, I hope it's clear.
Okay. But said for him, I believe, almost I believe, are you next of kin of Mr. Fulan?
Yes.
كده.
Okay. There is 2 points. You are the next of kin. Yes. Okay. We are here to discuss about his health issue. I assume that we have permission to talk about his condition. This is the perfect and the complete sentence. Are you the next of kin? Yes. We are here to discuss about his health condition. I assume we get permission from him to talk about him. Okay, doctor, go ahead. Go ahead. Okay. Okay, let's go to the next scenario. Thank you, Dr. Samah and Dr. Ahmed for raising this point. Every time I clarify it, and I hope it will be clear after I clarify. No problem to ask, but please don't believe without evidence. Many people they are saying, oh, for example, X failed because he asked about the next token. Okay, you have the comment for that? No, so don't comment, don't believe, don't spread it. Other people will get wrong information by this way. And it might be the truth different totally from what happened or from what you heard. Okay. Try to get it in a clear way from the candidate himself, not from someone who know about this candidate or his friend or the mentor who heard from the candidate. Ask the candidate directly. Okay. Thank you, Dr. Samah. Okay. We have Mr. Joe Smith, 50 years, diagnosed with pancreatic cancer for palliative care, aware about the diagnosis and plan of management, wants to talk about his GP that he didn't diagnose him earlier, as he was complaining of abdominal pain for 4 months, and the GP gave him omeprazole, took to the patient and addressed his concern. Okay. Seems nice scenario.
This is my real exam scenario, and I fail it.
Perfect. Okay. No, perfect. Your real exam scenario, but I'm so sad for you. Sorry, Dr. Sam.
No, no
Not
problem,
perfect.
because I need to, I got the feedback,
Okay.
so I need to make
Okay,
it.
let's do it. Okay, let's start.
Okay.
Hello, I'm Dr. Mukhtar, the doctor in the unit today. You must be Mr. Joe Smith.
Yes, doctor.
You are 50 years.
Yes.
Yeah, we are here to discuss about your health issue. Is that okay for you?
Yes, please, doctor.
Yeah, before proceeding, can I ask you, how do you feel, Mr. Joe Smith?
I'm feeling well. Yes. I'm
Okay.
diagnosed with cancer, and the doctor told me that I might not live too longer.
I'm so sorry to hear about that, and be sure that we are here to support you and to be side by side with you. And please, anytime you have any concern, stop me and ask me immediately, okay?
Okay.
Before proceeding further, can I know what do you know so far about your condition?
What's happened that I have been diagnosed? I was complaining of tummy pain for 4 months. I went to the GP for many times. He gave me only medication with omeprazole, and then at the end he did for me he referred me to the hospital and they did for me a scan. And they found that I have pancreatic cancer, which is more aggressive, more advanced. And they told me there's no curable, it's only palliation for you. And I'm thinking I might have only 1 month and then I will die. I don't know.
Oh, I'm so sorry to hear about that, Mr. Joe. Again, I'm reassuring you that we are here to support you. I know it's so difficult to hear about that, and uh, again, I'm so sorry what you went through. What's your expectation about this meeting today?
I don't have expectation. I just want to discuss with you regarding the GP diagnosis. This is
Yeah,
this.
yes. Again, I appreciate what you shared with me, and be sure that I'm here to address all your concern. First of all, again, I want to reassure you about the your diagnosis. I know it's so difficult to hear about that, and I know it's the coming uh, maybe month or as we have discussed, we don't know for how long. Anyway, it will be much difficult. However, be sure that our team, all doctors, all nurses, and also other teams that they might give you any support will not be in hesitance to give you this support. And please um, accept our words that I know that this is difficult for you. So please, if you have any concern, let me know and I will address it.
Yes, I just want to ask you regarding the GP because I went to him and he at the beginning he gave me some medication. Why he didn't diagnose me with this cancer? If he diagnosed me with this cancer, so I can be treated and this cancer will not be spread as it's spreading now.
Yeah, I appreciate that, and I'm so sorry to um, to feel about that. And I'm not here to defend my friend, my colleague. Uh, Actually, the cancer in the beginning might be similar to other condition, and some doctors, if they don't have the good facilities or they didn't do too much in blood test or scans, this cancer might went hidden and no one can discover it unless he does some of the advanced scans or advanced blood tests to confirm the diagnosis. So again, I'm not here to defend my colleague. However, for 4 months, I don't expect that the cancer will get spread. It might be spread since before, and it's difficult to say it was not spread at that time. Are you following me?
Yes, and what if the GP did for me a scan? He can diagnose it and can he catch it from the beginning? Why he didn't? Do you think that he can if he did for me this scan, it will be helpful at the
Uh,
beginning?
I appreciate what you are saying. However, some symptoms may be similar to your condition, and you might think about it before thinking about the cancer itself. So, before doing these advanced scans, we can give some medication just to help the patient to feel free of these pains. However, if this pains comes back, we should think, especially if the pain is more severe or he has another symptoms, we should suspect another diagnosis. And this is what happened, I guess so. Are you following me?
Yes, but if should the GP has done this scan earlier?
I appreciate your concern. However, this scan was done before. I guess the spread will not be over the 4 months. Cancer usually takes longer time to spread over the body, and it's not only a matter of 4 months. Did you get this point?
Okay, so you mean the scan won't be helpful at the beginning or now? It won't affect my condition.
I guess if it was done earlier, it might be diagnosed with the same as cancer of pancreas with some spread to other organs in the body. I hope it's clear now.
Okay. Okay.
You have any other concern?
No.
Okay, you want me to explain more about your condition?
No, the doctor explained for me about the cancer.
Okay. Okay. Did anyone told you about the management plan?
They told me it's a palliative, but you can tell me what.
Yeah, okay. Let's say about palliative some words to be in the same page. So palliative team is or are a expert team that they are dealing with cancer patient with spreading to other organs. Again, I'm so sorry about your diagnosis. However, this team will help you to be in good care and pain-free in the coming days, and also to be free of any infection or any depression or any change of your appetite. They might help you for the intake of food along with our diet specialist. Are you following me?
Yes, okay. I'm following you.
Yeah.
Hmm.
Can I ask you some question?
Yes, okay.
Okay, before going further, are you aware now about palliative team?
Yes.
Yeah. Okay. May I ask if you have expressed any living wish?
What do you mean by living wish?
Yeah. If
My
are you willing?
Hmm?
Yes. Are you willing to do something for you if you are not aware about surroundings?
Yes. You mean
May-
that I have the decision what to do, my wishes then?
Yes. Yeah.
Yes, I told my wife that I'm happy to stay at home in peace.
Okay. I appreciate that, Mr. Joe, and be sure that we will document that in the file in order to give you what you want. Is that okay for you? Okay,
Mm.
anyone nominated by you to take decision on behalf of you?
Yes, my wife.
Okay, that's good. I will also document her name in the file, just in need for any details or any further plan to be contacted in order to be aware about our plan. Do you have any other concern?
No, thank you.
Okay. Apart from this, Mr. Joe Smith, can I ask you more questions?
Yes, please.
Who's dependent on you?
I'm living with my wife, and she's also working. We are both working.
Okay, and does she need any support?
Mm, yes, she might need some support.
Yeah, okay. Don't worry. We are taking care of that, and we can involve our specialist team for concern for this issue.
Okay.
Anyone else
Time.
dependent on you?
No, time.
Time? You have to alarm me 2 minutes.
I didn't. I sorry.
Okay. Okay, you can comment now.
Okay, so I will comment as the comments that came to me. Okay, I will read the comments in the exam.
So
But first,
you did the same as I did? Okay, let's
yeah,
hear the yeah.
because I think I missed something. But for you, you did it. I'll comment first of you, and then we'll discuss my.
Okay. Yeah, let's read. Okay.
So you did it well. You show empathy. You did it well by asking, are you aware about the palliative care? That's good. But you can say one of the palliative care, it could be chemo or radio. Because this is one of my comments that I didn't say chemo or radio. I don't know.
Oh my God.
Okay.
And it's not common to do chemo or radio or
Yes, you
whatever.
can say the
Okay.
palliative could be chemo and radio. I will read it next.
Yeah. Good to know. Thank you.
And the other thing, you did it well by saying the carer or no. You asked about the advanced will, and you did it well by the GP because the patient has asked me this question. Could he do the scan for me earlier? You did it well that you said, I think this is right that you were saying, because the patient was keep saying his GP can catch it earlier before it spread. So you can say that this type of cancer, when you have start to have symptoms, it means that it has spread already. So and also the GP start when the patient has some symptoms as abdominal tummy pain, they start for him the simple things, and then if there's no improvement, they can refer him to the scan. It can be in your condition, and at the end, if the patient insists to complain about the GP, tell him you can go to complain, no problem. But I didn't insist in this scenario. Okay. A part of that, you did it well. You show empathy, you give him support, you give support to the family, you explain the palliative care. So I think you did it well. Okay. So let's read. I will tell you what's happening.
Yes, please.
They said in the comments that I didn't explain that the diagnosis is difficult. Does not explain that diagnosis is difficult. This is the first comment. Consider chemotherapy. Doesn't explain that the pancreatic cancer by the time is for advanced. I couldn't read it. I don't know how is it written. It's written doesn't explain that pancreatic cancer by the time is useless or useful for advanced. I don't know. How this means.
Difficult to diagnose, maybe, or useful. I don't
I
know.
will send it. Maybe someone can read it.
Okay, yeah, let's try. Okay, what else?
Okay, let me see it. I'm sending it now. And yes, this is one of the examiners. The second one showed that didn't appear knowledge about process or care. Pancreatic cancer. So I don't have what is the process and care for pancreatic cancer. So I think he's saying about I need to talk about the palliative care, the chemotherapy, and all these things.
Okay.
Signpost to a manager re-complain. To practice managing re-complain. This is something wrong that I did. I don't know. Try to explain pancreatics. Try to explain pancreatic cancer is unfortunate present late. I don't know. This is what is. I will send it also because some of them I don't understand what's exactly.
Oh.
Maybe someone will read it. They have bad writing. And at the end, when asked should the GP have done scan earlier, I didn't answer. Okay. And at the end, I start to ask about alcohol and drug history. This is wrong. I know this is wrong.
Yeah,
I
never
finished this
touch.
station at 6 minutes or 7 minutes, and I couldn't have any questions. So I asked him about alcohol and smoking, and
So
this is wrong.
it means that you are blaming the patient. Yeah, you are blaming, and you are putting more trouble on him.
So this is wrong because I think I should this terminal if he's smoking or drinking and he will die. So why I was asking this?
Yes, exactly. So never ever palliative and a patient is going to die to ask him to deprivate himself from smoking. So do whatever you want. This is your end of life.
Yes.
Die in peace.
Yes. So this is the comment. And I think
yes, exactly.
Comment that I don't understand. So we can discuss it because this real case and this is what the
Thank you.
Dr. Sarah,
what?
writing in the chat difficult to read it.
Yes, that's the problem also.
I took screenshot.
Yeah, they want us to learn from our mistakes, which are not clear by their handwriting. I don't know how. You are commenting on us. Should be clear. Please clarify your handwriting so I can learn from my mistakes. What the benefit of writing a map or drawing a map by my mistakes? How can I understand what I did wrong or correct? Or I don't know why they are doing that. It seems like they are punishing us that we did bad, and this is also your punishment. You cannot see your comment. It's very weird.
Anyone is able to read what's it.
No, I can't. It's like
by the
uh,
time يلا الباقي الكلام شنو
Yes, doesn't explain that pancreatic cancer by the time is what for at something. Is something for something, I don't know. For
yeah. So you can
Mhm.
Doctor, it is written diagnosis. The triangle is diagnosis. The first comment,
okay.
the triangle is diagnosis.
So doesn't explain that pancreatic cancer by the time of diagnosis is useful for advanced. Okay.
Actually, the comments are more intentional. Like as a candidate, I will say he doesn't want to pass you. Doesn't explain that pancreatic cancer by the time diagnosis is usually advanced. Actually, pancreatic cancer we never diagnose this when it is initial stage. Usually we diagnose
it takes
only in the
time.
advanced stage. That is
Yeah.
the rule of pancreatic cancer.
So I should
Okay.
I failed the station. I should tell him because he told me before this cancer spread. So I should tell him usually when you start to have symptoms, it means that the cancer has already spread, and it really
Yes. The red flag symptoms is usually abdominal pain, chronic abdominal pain, and it is relieved by the painkiller. That is the beauty of this cancer. But only the sudden loss of weight and sudden appearance of painless jaundice is the red flag finally that you have advanced already. These are the two extremes of this pancreatic cancer. And no pancreatic cancer we can diagnose in the early stage.
So I should say
By the book. It is by the book. It is not from us. It is by the book. Yeah, so that's what that is the knowledge he wants to tell you, because you have to defend your colleague also. It is not that you cannot defend your colleague, because we are colleagues and he's a physician, he treated, and you have to stressfully significantly say that pancreatic cancers are always present in an advanced stage when it comes. The patient comes with advanced stage only. You have to signify that. So, meaning to say, the doctor is also not at fault that he missed the diagnosis.
okay.
Yeah. And anyways, we are covered by insurance in UK for all the patients. If you have to subject for the scan, of course, it will be covered by the insurance. But when you will refer the patient for scan, what scan you will do? Is it ultrasonogram? Is it CT scan? Is it a MRCP or it is MRI? Which one you will do? Just for the abdominal pain, you will do scan? Only if you have a painless jaundice, that is the time you are alarmed. When you have a severe weight loss, you will be alarmed. These are the two signs we get in pancreatic cancer, and the pressure symptoms from the malignant growth in the abdomen. The stress pain caused on the mesentery. So it is a pain. The patient will come with pain and fullness. You will have lack of appetite. Only these things. It can be explained by many things in the abdominal organ pathology. But by the book, pancreatic cancer will present in advanced stage only. If you want clarification, you can refer the book.
Yes.
And
so first thing. And I
Hmm.
think other thing I need to, they said that I didn't talk about the palliative chemo.
Palliative what?
I should talk to him about the palliative chemotherapy.
Yes, yeah. This is recently in the advanced stage of pancreatic cancer. There was a scenario very long before that in palliative treatment, it is not only the pain management and comfort care. It is also a chemotherapy drug which has got also a part of the pain management. Recently, it is included in the palliative pain palliative care, and it is being used, but of no use. It is not going to solve the problem. It is not going to shrink the tumor. It is just going to prolong the life for 6 months. And how much is the evidence based? I'm not sure. How many papers have been submitted in the journal? I'm not sure. But this medicine has been used for this. And I think it is one of the prostaglandin phosphodiesterase inhibitor, I think. I'm not sure which medicine it is. But the patient will ask you, is it going to cure my pancreatic cancer? You will say no.
No, he didn't
But
ask. Where is it? He didn't ask this question. He said, "I'm dying." So he was aware about this condition and aware that he will die. But
so
in that didn't appear to knowledge about the process or care for pancreatic cancer.
Mm. But regarding the radiotherapy, I think radiotherapy has very, very less role in a chemotherapy. Radio chemo has a less role in pancreatic cancer because most of the radiation, it's not going to help the patient. It will aggravate the obstructive symptoms and patient will be bed-bound alatul. He will not have life. But in chemo palliative care, you will have life. Patient will be mobile, ambulant. This is my latest knowledge about it. But still, how much it is evidence-based, we have to refer from the journals, from the UK journals. Recent pancreatic guidelines for the chemo palliative care and radio palliative care, we have to check. Recent evidence-based. Did you appear recently in the exam?
Yes, last done.
Yeah. So that means we have to refer. How much evidence is supported in this one from the UK especially?
Okay.
We have to go through the Google.
Thank you.
So
Yeah,
the second is, yes, doctor?
Yeah, no, I want to thank you only. Okay, go ahead.
Yeah. The second comment did not appear knowledgeable about the proven case. Reference, pancreatic cancer. He is saying you don't know about the pancreatic cancer. The second examiner. He is really very, I think he is a really radiologist. He has no life in his life.
I guess this is bronze or cons, or it's proven. I can't read.
Which one?
I think about process or care pancreatic cancer after is the process and care after pancreatic cancer.
Progress or process?
Process
Process as a case of, because your mind is not ready to explain about what is pancreatic. You didn't process your mind to explain the patient how a pancreatic cancer will present.
But the patient already was treated in scenarios that were about the cancer. And
I don't know, this is yesterday's session or day before yesterday's session. I think Dr. Basam only told how to break a bad news.
he already
You have to explain the disease,
but
pros,
No. But
complications.
it's written that he knows about the condition.
yes, it was broken.
Yeah, but still, no. See, he's blaming that why my GP did not pick up me in the early stage. But as a physician, I know that pancreatic cancer always patient present in an advanced stage only. And all the gray area for the 1 month, 1 year, 2 years, they'll be just on PPIs and painkillers.
But already, if you see the second commented treatment that I tried to explain pancreatic cancer and he present late. So I already told him that the cancer is presenting late.
Unfortunately, this is unfortunately or what?
Yes, try to.
Yeah, unfortunately presents late. Yeah, he's saying that.
So
Unfortunately presents late. You
So
should have explained like that.
told him that pancreatic cancer is presented.
So this is good comment or bad comment? I don't understand.
Actually, she has said, unfortunately, pancreatic. She has told with the surrogate, pancreatic presence lately. Until then, you cannot have a diagnosis. This is what you have said. I don't know what you said to the surrogate.
Did you say that, Dr. Sarah? You said that the pancreatic cancer always present late?
Yes, I told him this type of cancer is aggressive and usually is presenting when it start to spread in advanced stage. So this is wrong or right?
So this is wrong now.
It is wrong,
yeah.
So why it's wrong? You are saying now that.
I guess, yeah, you can say it's difficult to diagnose it from first time. And you should suspect something different. And I think also, Doctor, what's your good name, please?
Dr. Sunita.
Dr. Sunita, yeah, I guess you said the same idea that, yeah, it might present, and from not from the first presentation, I will do scan for you, so I can suspect something similar to the cancer.
The red flags.
Yeah, but it's not red flag from first presentation. The
Yeah,
cancer, usually cancer means it might be their overgrowth without presenting itself. This is the cancer nature. That's why it's malignant one. It might live inside your body without knowing it, and suddenly it might appear like aggressive and spreading everywhere. This is the nature of cancer. This is the meaning of cancer,
Mm,
isn't?
mm.
So I guess this is the way how to say it. It might be presented as other disease, and for which your consultant or
Okay,
your
after
GP.
reading this comment, doctor, how
Yeah.
you will reframe your words to explain to the surrogate now?
I become
Doctor,
because he told me that I should tell him that pancreatic cancer usually presents in advanced stage, and in the comments they said that I already
Yeah,
told
it's the same. Yeah. So
so why maybe I think I failed because for the alcohol and smoking, and I didn't talk about the offense directed and will, but they didn't even write it in the comment that I didn't talk about this. It's not written. But the other issues, and also that I didn't talk about the chemotherapy.
okay, where is the key? Where is the alcohol and smoking comment? I didn't see it.
And it no, okay,
So they wrote it. It's there, right?
yes.
Doctor, okay, no need, no need. I thought they told you in the
No,
station.
no, no.
Okay, so maybe this is. I guess this is the mark. It will be this mark for this point. It will be for the welfare, right? It will be 0, unsatisfactory.
Mm.
Dr. Sarah, tell us about the marks. After this comment, how they mark you? Borderline or unsatisfactory?
I have unsatisfactory in clinical communications
Okay, this is for the alcohol and smoking.
and unsatisfactory for clinical judgment and
Unsatisfactory, both examiner
yes, in managing
and
concern and managing patient concern. All of this.
concern. Concern, you didn't ask what's your concern?
I asked him, but I don't know.
No, maybe you didn't.
I feel in all this station. I feel it all. Yeah.
Doctor, maybe is it something that they couldn't hear your voice, what you asked, or what did you explain to the surrogate?
No problem. I'm not saying I need to learn. I'm not blaming the previous. I want to know because I need this scenario is commonly coming.
Yes,
So
it's common.
I want because we might face it. So I shouldn't say that you can complain about the GP because they make it. This is wrong that I told him to complain about the GP. So we shouldn't say that.
Did
And
you say that? Did you say that you can complain about your GP?
yes, because I told him because he's saying that if the GP.
No. This is yes, this is mistake also. You offer him to complain against his GP because of late diagnosis.
I told him and no, I explained for him that the GP are seeing common cases common and abdominal pain should be management
Okay,
firstly. And then at the end I told him if you want to complain you can complain.
so you offer complain, and that's at the same time you suppose not to say that at all.
Ah,
Your GP, I kept saying I'm not defending my colleague. However, he didn't do anything wrong. He tried his best, by the way.
hmm,
Your GP or your colleague, I definitely he doesn't have mistake.
hmm,
Whenever you say to the patient or surrogate, you can complain him. It seems that you are saying, yeah,
yes,
he did a major mistake or a fatal mistake. He didn't diagnose you.
okay,
And indeed, it's difficult to diagnose such condition by GP. Whatever the GP is doing, he doesn't have the tools to diagnose your condition. So the best thing to do is to give you some medication in the best of interest. And if you come back to him, he can refer you to us. And this is what happened in the 4 months. I guess this patient visited the GP maybe twice. First time as a first presentation, second time maybe not improving after painkiller, and he might give her another painkiller. Then the second or the third time, he referred her to the hospital. So don't blame the GP or don't put the responsibility for diagnosis on GP. How he will diagnose and how he will think about cancer from the first presentation.
yes,
And difficult to know if she has constitutional symptoms. She might have, but you cannot ask this question, right? You can't say, can you tell me if you have loss of weight? I don't know if you can ask this, but if you ask, maybe also history taking. So the best way here is to assume that your GP tried his best to diagnose, and he gave you the best interest medication for your condition. Then, when he had reviewed the deterioration or non-responsiveness of your pain, he referred you to us in order to find out what other possibility. That's why he did the best. Once you said complain, I guess they might fail you. Plus the alcohol and the smoking. So these are the lessons from this scenario. Don't ask in the palliative care about smoking and alcohol, and don't blame your colleague unless there is a major clear mistake, like the scenario of inflammatory bowel disease and prescribed steroid without enumerating the side effect, and the patient had avascular necrosis of the hip and he had replacement. This is mistake. So unless it's clear mistake, don't assume that your GP or your colleague had a mistake.
Okay.
Okay. And I guess also this scenario is not medical error and not complaint in the title.
Not a medical error. No.
Of course. So why you are offering here to complain? You
Yes.
should defend, and you are saying I'm not defending. Because if you defend clearly or frankly, I am defending my colleague, he doesn't have mistake, you will give her assume that he did a mistake and you are defending him. No, you can say I'm not here to defend my colleague. However, he didn't have a mistake and he did his best, but I am not here to defend him. And this is your task, to defend your colleague by this way. This is my opinion also. You have to defend him even with saying I am here not to defend my friend or my colleague, and any doctor or any GP in his situation, he will do that. You can do this as evidence, I mean.
Yes. Okay. And how will frame? How we will explain the other comments that to explain the pancreatic cancer care and management? How we will explain it to the patient?
For me, I didn't say the chemotherapy or radiotherapy, but I learn now from this comment that I can mention the palliative. It might be also some medication can help to relieve the pain or to relieve the obstruction. This is also one of the scenarios in the communication. Some patient with pancreatic cancer, they will have obstruction to the bile duct and they will have jaundice, for which you have to do ERCP with stenting as chemo, also as palliative management.
Yes.
So you can say something about the palliative management, including the pain-free and infection-free and depression-free. Plus, they might also think about some medication or some surgery to do.
Yes. I
But
got 6 of 7, 7 over 16 on this station. It was my first station, and I got a full mark. But
the other scenario,
the other communication, I got full mark, but this one I got 7 over 16.
no, actually, these two mistakes for this scenario seems like major mistakes. I mean, the alcohol and smoking never ever offer any stop or any.
I was having extra time, so I didn't know
So,
what.
today I had some time, and you can observe that, or you could observe that I stopped a while thinking what to say, but I will never ask about alcohol and smoking. This is what the benefit of practice. You will know in such scenarios you will not ask this question. Okay, if you
Yes.
have time, support. Today when I had some pause, if you remember what I say, what I can say now, I offer you support, right? I ask you who is living with you, who's dependent on you. Then you
Yes.
told me I am the wife. My wife dependent on me and she's working. Then I ask you who's else dependent on you. You can find a lot of social question to ask.
Yes.
Just try to create some ideas about the social. Anyone taking care, anyone helping you in your activity. How is your daily activity? How is you have any hobby? How is your mood? We can share. You can share with us any ideas, but don't touch the alcohol. And so this is the take-home message from this scenario. Alcohol and smoking in palliative or cancer patient advanced, it's like fatal mistake. Let's go to
Doctor,
the opposite.
can we
Yeah,
refer the patient? Yeah.
yeah, go
Uh,
ahead.
yeah, we have only 1 month for the patient to live now. So
Yeah,
is it okay to refer them along with the, there is a
mood.
group, no? Pancreatic cancer group, like
Yeah,
MS
yeah,
group.
yeah, yeah, yeah. Nice idea.
Do we have to refer or we cannot?
It's not as a must, but as an idea. Yes, you can refer. Yes, we have some group, social group. They have the same condition, and you can sit with them to just to be as a family.
Yeah.
It's a good idea. Not
Sometimes religiously also, we don't
yes,
know, maybe he's Christian and some religious people, they can sit and
yes,
they
yes.
will discuss about the afterlife, the current life.
There
Like this,
are
do we
yeah.
can discuss or no? Or is it a sensitive issue?
Yes, good issue also. If you have time, of course. But if you have time and you didn't ask about advanced directive and you are thinking to talk about these issues, this is a problem. You got it.
We can say only if your father, if you have any religious preference,
Yes,
we can refer you to special.
no problem. But
But take
in one occasion, Dr. Sarah, you have to fulfill the whole criteria of this scenario, which is advanced
yeah,
directive and
but
lasting power of attorney,
we don't
support.
go deeper.
Yes, if you have time and you are sitting silent and you want to talk about something, you can raise these issues,
Yes, okay.
okay? But don't leave our important points and talk about these things like religious support or
Yes,
whatever,
yes, right. Not
okay?
this professional. Give him option and finish.
Yeah, and yes, you can raise any issue in his life apart from smoking and alcohol,
Yes.
okay? Let's go for the uncertainty cancer in the opposite side. You have patient with cancer or uncertainty lung cancer. Okay, he's still not diagnosed with lung cancer, but they suspected lung cancer, and he sat with you to address and to tell him about the result. Would you ask him about smoking and alcohol? What do you think?
Yes. I know.
Yes, this is the difference between both. This one is pancreatic cancer with a metastasis, and this one is still not diagnosed yet, and it's the cancer is related to his smoking, right? You can ask.
Yes.
Okay,
Dr.
okay, this is
Bassem,
as uncertainty. Okay, I will receive this question, but after this point, okay, if you have cancer lung with metastasis and again for palliative therapy, will you ask him about smoking?
No, no, at
Yeah,
all.
yeah, this is not because that patient or the first patient still he might be in the early stage, and of course the smoking will harm him and he will make his cancers more aggressive or increasing or worsening. But in the second patient, he's already spread and so on. So if you don't have confirmed diagnosis by histopathology that the type of cancer, don't you can speak about smoking. But if you already he's diagnosed and spread away, so you don't talk about smoking. Okay, sorry for interrupting you. The one who asked, Dr. Ryan or Dr. Samah?
me, Dr. Bassem, you
Ah,
mean by this point, if
Dr.
any
Khatib.
scenario
Yeah.
other than cancer explanation about the smoking and alcohol history in social history, it is not important, usually not important to ask about alcohol and smoking in a relevant scenario. I mean, not related to alcohol and smoking.
Okay. I will be with you in the first part of the question. Smoking
Yes,
and alcohol in irrelevant. Okay. What about
yes.
smoking in all disease? Will you think it's important to give advice about even irrelevant? Of
Not
course, if you
not
have time.
important. Not so
Okay.
important if it's
No.
irrelevant.
It's if relevant. Why you are asking it in the social history in any scenario? I mean, clinical consultation, and you are
Okay,
saying,
this is my question
yeah,
by
this is
other
also the
way.
answer. This is the answer. We are always saying the smoking is harmful for your condition in general,
Yes,
plus
yes,
plus in your condition. He might have cough and short of breath. You suspect lung cancer. It will be direct impact. Okay,
Yeah.
if not related, why you ask smoking? For example, patient came with the abdominal pain. Why you ask for smoking?
The increase the risk of disease.
Yes, other disease. Yeah, smoking is not something good to leave it if you heard about it. And by the
Yes,
way,
yes.
if you didn't advise, they will minus you. So whenever you have a disease and it's direct or indirect to the smoking, you have to ask about. Unless the patient is dying, even it's not related to smoking. Pancreatic cancer, is it related to the smoking? No, but I will not ask because he's dying. Let him do whatever he wants. He will die sooner or later. Okay, but if patient still having some cough and short of breath, and still they are suspecting either TB or cancer, what do you think? Would you advise him about smoking or no?
Yes, it's important.
Yes, important. This is the difference between both scenario. But if he advanced cancer in the lung, this time I will not tell him. Let him smoke whatever, he will die. This is the point.
Sorry, my second question in this scenario, patient in palliative care, if the organ donation not mentioned in scenario, it is important. Oh, it is for me. I must mention to surrogate it about organ donation or not.
I will ask you this question. What do you think patient with cancer pancreas or any cancer in the body will be fitting for donation? Is he fit for donation?
Not fit.
At all. By the way, the organ donation team first or not first, one of the criteria, does this patient diagnose before or has diagnosis of cancer, or he has suspicious of cancer even, definitely they will roll out him from the list. They will not take organ from cancerous patient. They will harm the recipient, right? So at all, it's not this patient. The disease, you can take organs from them only stroke or intracranial hemorrhage or traumatic brain hemorrhage after trauma. Why they are selecting trauma patient? I will ask you this: why they are selecting trauma patient specifically with brain injury? Of course, patient had trauma and he had severe head injury with coma, brain stem death. What do you think? What do you think about the organs of this patient? Very healthy, right?
Yes.
One person who's living happy in his life and he's enjoying his life. Maybe he's in adulthood with his friends. He's doing furious driving and he had an accident. He became severe head injury and brain dead. What do you think about his organs? The best organs ever in the medicine. Why? Because he's healthy. He just
Yes. Yes.
in adulthood.
Fear of the disease. Yes.
Yeah. So don't ask cancer patients or any patient having chronic disease. The diabetic patient, do you think diabetic patient I can get organ from him? Of course no.
No.
He had chronic kidney disease, nephropathy. What the benefit of his kidney?
Organ involved. Yes.
Yeah, most of his organs are either affected or maybe damaged. In the opposite, he's in need for organs, not to donate organ. The same idea for any chronic disease. But the best patient to donate is the surgical trauma patient because he's very fit. I mean, other organs. Okay.
And the other things, if the scenario
Yes.
can offer organ donation, you will offer. Apart of that, you don't need to say that.
Yes.
Not
I
written.
agree with Dr. Sam.
Yes.
Of course.
This will be another station. It will written in the scenario. Ask about organ donation. If it's not written, you couldn't say it at
Yes,
any.
this is Dr. Sarah, this is my question.
Yes, yes. Only if it's
Not
written.
mentioned in the
If
scenario. And
okay,
the patient fit for organ donation.
yeah, if they were right for you, this is the first thing. Second, situation. Okay, if you have a young patient and he diagnosed with brainstem, I guess it was coming before as hidden agenda, but nowadays they are clarifying the task. Talk
Yes.
about the organ donation. But sometimes traumatic head injury specifically, if this scenario comes to you in the exam, I guess 90% they want you to talk about organ donation. And they mention to you in the scenario, patient diagnosed as brain stem death. Why they wrote
Even it is not
this?
mentioned in the scenario.
I
I
guess
must
that. I guess
mention.
so. I will go through it. Specifically, young, healthy, had head injury either by trauma or by accident, and the patient is diagnosed in the scenario brain dead or brain stem dead. Why they wrote it for me? I guess this is for organ donation, even if they didn't write it for me. By the way, don't do it from the first sentence. No, you can touch it
Yes,
at the
yes.
end. But your task, you should do it first. What they wrote
Even
in
it
the
is sorry, Dr. Basim, even it is not mentioned in the task, in my task. This is
yes,
it
if
is
not
not mentioned
mentioned,
choose
you
patient
can
for
touch
organ
it.
donation.
You can touch it at the end. And
Okay.
if they touch or if they wrote it, you have to talk about it in details. But if not, you
Okay.
can touch it at the end. But the
Really
task will
become
be
this become conflict points in some scenario.
no, it's clear. If brain stem reflex diagnosed and you have to talk to the mother, okay, what you will do in the scenario? You will talk to the mother as breaking bad news. I'm so sorry what happened to your
Yes,
son.
yes,
He's blah 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 blah. And now he's
yes.
diagnosed with a condition called after doing some tests. And I am so sorry again to say he is having or his brain is gone or his brain is dead. I'm so sorry to say that and give him here's some time to react. Then again resume speak about how are you, how do you feel now, and
Yes.
explain. But if they write for you patient for, and at the end you can't touch the organ donation. Okay, if they write for you patient for organ donation, brain stem
Okay.
death, you can
This is the
start.
clear.
Yeah, it will be clear, and you can spend through the scenario in details about the organ donation. And you might also ask for consent, you might ask for approval and take your time, think about it, and so on. But in the first scenario, you can just say uh, they might be an
To
authority
organ.
or team. They might talk about something which is called organ donation. Have you ever heard about that? No, doctor, I am not. Okay, it's a process in which they can take, and or Mr. John can help others by donating his organs. And we are not here to discuss this issue now. I can tell you in another meeting, or the team will meet you in another meeting without taking consent or whatever. But at
Okay.
least you touched it.
Mention. Yes, yes. Okay.
Yes. Okay.
Okay.
Yeah. Thank you, Dr. Hadi.
Then clear. Thank you.
Most welcome. Any comment, Dr. Sarah?
No, thank you. I got it.
Okay. Yeah. Also, you can confirm it if you want about the organ donation issue in scenario not written as an organ donation task. If you have it in the exam what to do, you can ask some of your consult. But I guess from I mean, as my humble opinion, you can touch it at the end, even it's not your task. Why? Because this diagnosis means organ donation in brackets. Brainstem death in brackets equal organ donation. This is also in our practical, real experience in ICU. The organ donation team always asking about such condition. You have any patient with head injury, comatose patient, GCS 3 out of 15. If we have such patient, they will consider them as potential donor patient. So I guess also in the exam you can do it even without details. But if it's a task, you can go ahead with all details you know about organ donation. Okay, we spoke 32 minutes about the feedback and I like to be discussing and interacting session. Why? Because these things, if not clear for some of us, it will be more clear with the discussion apart from the practice itself.
Yes, because we know, I think, how they are thinking
Yes,
wrong and what's right. So they deduct mark about that complete.
exactly.
They deduct mark about that I don't know about the palliative chemotherapy. So this is things, some of them I don't know, and some of them they are right. But that's why we don't know how the examiner will judge us. That's why it will be helpful. No.
Okay, let me say something also, Dr. Sarah. Sometimes you had a mistake, and the examiner, for this mistake, after this mistake, I mean, whatever you did, he will fail you. Believe me, he can fail you. Whatever you did, if you had a major mistake or a mistake he doesn't like, or maybe I will say, if you did something irritated him, he will fail you by any means.
Yes. All right.
Yeah, that's why they are writing sometimes like haphazard. If they are serious, they can write with good handwriting, I guess so. But why they are just drawing, and they want us to guess what they wrote?
Yes.
Anyway, it's a war, and we have to battle it
Hopefully.
soon, inshallah, soon. We are learning from mistakes, and no one, yeah, there are some of candidate passed from first, but fortunately
I
they,
know many people didn't pass this diet with 1 mark.
yeah,
1 mark.
yeah, I guess it's
I don't know.
intentionally this
Yes.
diet specific. I don't know. I don't. The previous diet, a lot of people passed. This
There
diet,
were many people, and most
yeah,
of them
people
are
get.
training, and they were very good. And with 1 mark, they failed them.
Yeah, yeah. So this is what also practice in the last diet in the whole world. I
Yeah.
don't know what happened to them. Why they are more irritant. Maybe they passed a lot of candidate in the first and second diet, and they have to restrict the number in the third diet. I don't. Maybe that's why also 1 mark. It might fail you. Anyway, hopefully the coming will be better than what Andrew went.
Yes.
Inshallah. Yes. Any other question? Any comments?
Oh, thank you.
Thank you, Dr. Tomorrow, unfortunately, we'll have off because some social issue. I can't
Okay.
join tomorrow, so we can postpone till Saturday. So we'll get Thursday and Friday off,
Okay.
and inshallah, hopefully, we'll meet on Saturday.
Inshallah.
Yes. Any question? Any comment before ending the session? Thank
معلش
you.
يا دكتور باسم
Yes, sure. اتفضل.
I disagree about if you have terminal lung cancer,
Uh-huh.
you should encourage the patient to stop smoking. I'm
No,
not
no.
talking about the progress of the disease. I'm talking about making the patient symptoms free. The patient is already having shortness of breath and on oxygen, so smoking is aggravating the condition and putting him
Okay.
in.
Yes, I agree from your side only, but let's talk about the patient side. What do you think if you told the patient you have advanced cancer and this cancer due to your smoking, and please stop smoking in the coming or the last month of your life because you might feel free of cough and blah blah. What do you think he will tell you?
I think when I explain to him that palliative care is not targeting the cancer and it's making you pain-free and symptoms-free,
Okay,
and the part of that is stopping smoking. I think
good.
that.
Okay, good. Okay, and he will believe that. He will believe that if he stops smoking, he will be.
But if the patient is on palliative care is meaning that it makes the patient more comfortable. So if you ask him to stop smoking, you put him on more stress. So he will live
Yeah,
2 months. So he will be in stress for what? It won't affect his condition.
exactly.
And it won't affect his breathing. That's why they are thinking, and they deduct for me this mark because I'm asking him about smoking and alcohol. This might be the thing that can make him feel happy and comfortable in the end of his life.
Yes, yes.
That's why I feel this patient. So I'm thinking this is the way of thinking. Patient on palliative care, he need to be comfortable, not distressed. So I'm
I'm not talking about the cancer of pancreas. Talking about something directly affecting the breathing.
Yeah.
Okay,
But-
no problem.
yes, but
No. We got your point, Dr. Ahmed. This is in real life. You can say it, but the patient, even after he closed the door, he will smoke it. Believe me, I will tell you. In ICU, we had a lot of patients they admitted because of MI, okay, non-STEMI for any reason or whatever, but they are heavy smoker. Guess what they are trying to do? They are smoking in the ICU. They are trying to smoke in the bathroom of the ICU. In the acute state of MI, they are not thinking about smoking. What do you think if they told you, if you told them you will die after 1 month, please stop smoking? They can't. Even they are saying, I can't. I am smoking for 50 years or 40 years. Do you think now I can stop smoking? If he told you this answer after you advise him to smoke, I think you might fail, even if he is diagnosed with lung cancer. This is my opinion again, Dr. Ahmed. I respect your opinion, but I don't think it makes sense for the patient that the smoking, if you stop smoking, the cough will be better. Sorry, he will say, I don't care about the cough. Let me enjoy my last days. I think so.
Okay.
I hope you understand it.
Yes. Okay.
So yeah, in exam point of view, they want the patient to die, as Dr. Sa said, in the best condition or in the comfortable condition. Plus, you stress him by stopping. Also, you stress him by the addiction signs and symptoms. The nicotine withdrawal is very difficult. Signs or symptoms, very difficult for the patient. And if you will do so, you can, yes, offer something else, but not in smoker patient, in dying patient. You can offer it in, for example, chronic kidney disease patient, MI for recurrent stenting. Yeah, you can offer them the nicotine patch or the gum or whatever. But do you think you will give the patient, a lung cancer patient, a nicotine patch and you tell him you will be okay with this nicotine patch, or you will give him a gum? He will not enjoy it. He is enjoying with his smoking. This is my opinion again, and I respect what you said, but I'm not sure if it's applicable in the PACES exam or not. But if you hear it
Okay.
as evidence-based, okay, let's share it with us.
Okay, we will search. Okay, thank you so much.
Yeah,
Thank you.
search, and also for the comment. I don't think there is cancer scenario with smoking, and you can find the comment and the feedback that he mentioned the smoking. It's occasionally difficult to find such scenario. Okay, Dr. Ahmed Ali. No need because already dying. It's not logic to refer patient to smoking cessation clinic. Yeah, I guess so.
Mm.
Although it's related to the chest symptoms, but again, he is dying. So their direction to let patient die in peace and enjoying the last days of his life.
Okay.
Okay, thank you, Dr. Ahmed. Nice question, really, but and a comment, but I am not agree with you for some extent. But anyway, if you are comfortable with that, what do you think you are? Yeah, I mean, you are feeling that is making sense for you, but for me, I think it doesn't make sense. Sorry for this. Okay.
No problem. Okay, thank you.
Okay, thank you, Dr. Ahmed. Okay, thank you, and thank you, others. Any question, any comments, please? I like to argue with me. It's okay. The discussion here is two ways, not only me to talk. So I have to clarify the things, and you can clarify also your opinion. And let's see, maybe you are right. And sometimes I'm not always right. Sometimes I'm wrong. And if you correct me, this is a good thing also for me and for you. So please
Okay.
feel
This
free
is the
to.
benefit of discussion. Yes,
Of
okay.
course, yes. Now I think you are convinced more. Especially you have also another supporting comment, Dr. Ahmed Ali. So yeah, I guess you are convinced. Okay, if you
Okay,
are
no
not
problem.
convinced,
Okay.
also it's up to you. But if you have some evidence, share it with us so we can learn from this. Okay.
Okay. Okay.
Thank you, Dr. Ahmed.
Okay, thank you.
Okay, looking forward for more discussion. If you want, let's know. If not, let's end the session and wish you a nice weekend, Thursday and Friday. Enjoy your weekend. See you inshallah on Saturday. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.